Welcome. Congratulations on being selected for an interview at the Texas Health Fort Worth and TCU and UNTHSC School of Medicine Internal Medicine Residency Program. You have been selected from more than 1,300 applicants as a competitive candidate who we think would succeed here. We are looking for empathetic, collaborative, and humble individuals who possess a strong sense of personal responsibility, and we are pleased to offer you an interview. You've received many invitations, and we're excited that you'll be spending the afternoon with us. My name is Hillary Ryder, and I am the program director of our new internal medicine residency program. I was born in Atlanta, Georgia, but spent much of my childhood in Massachusetts. I went to college at the University of Chicago, where I studied sociology, and I focused on gender formation in pre-adolescent girls. Rapidly felt that there was more to the human experience than sociology, and so I spent the last year in a genetics lab, and then spent several years at UC Santa Barbara doing genetics work, and came to understand that there's more to life than genetics as well. I felt like medicine was the marriage of the two, and so I applied to medical school and ended up at Yale University School of Medicine. After completing medical school, I did my internship and residency at Dartmouth in New Hampshire and joined the faculty there as a hospitalist. I was on faculty for 14 years and really made medical education my passion. I was the clerkship director, sub-internship director, and then associate program director for 9 years, and then program director before being recruited to Texas to start this residency program. I'm so excited to be in Texas, not only because the weather is warmer, but really to have an opportunity to create a new and different residency experience for y'all. One thing I want you to take away from today is that our team is 100% committed to your professional growth during residency. We are looking to train tomorrow's internists to care for and improve the health of the people in the communities they serve. I love medical education. Working with trainees inspires me every day, and I give my all to it. Before we meet you, we'd like to tell you a little bit about our program and our hospital. You'll meet Dean Stuart Flynn, who is the Dean of Texas's newest LCME accredited allopathic medical school, TCU and UNTHSC School of Medicine. And you'll learn about our affiliation and collaboration with Fort Worth's allopathic medical school. I'll come back and share a little bit about our schedule and what training with us will look like. You'll also meet Dr. Jennifer Hinkle, our associate program director, who will share a bit about our didactics, benefits, and our wellness curriculum. And you'll also meet Christina Timmer, our coordinator and institutional diversity, equity, and inclusion champion, who will help you understand how we value diversity in every individual here at Texas Health. Over the course of your interview day, you'll have 2 interviews, one with me and one with either Dr. Hinkle or a faculty member of our intern selection committee. You'll also have the opportunity to learn a little bit more about Fort Worth by playing a game with us, and then we'll all come back together to make sure your questions are answered before the end of the day. Hopefully, by the end of the day, you'll have a good sense of who we are and why we love it here, and you'll get all your questions answered. I look forward to meeting you. I love working at Texas Health Fort Worth. We're the #1 hospital in Fort Worth, as rated by US News and World Report. We're the largest hospital in Fort Worth, and once our new tower, which is going to be right over here, comes online, we will have more than 770 beds. We function as a safety net hospital serving the underserved, but we also have a broad patient base of both insured and uninsured patients from all walks of life. Our campus is large and growing, and all of our rotations and our dedicated resident continuity clinic are on site. You can see our continuity clinic will be right near the emergency department. Our offices and the resident offices are in Harris Tower over here. And these areas over here are where all the ward medicine will take place. The subspecialty clinics are right over here, and there's ample parking available for all. We're also a magnet hospital for nurses and the 4th busiest emergency department in the country. We're not only top ranked for patient care, we're also top ranked as a healthcare workplace. At Texas Health, we pride ourselves on a collaborative culture, one in which we support one another as we all learn and grow. Our collaborative culture means that we value resident leadership, and we will make changes based on resident ideas and feedback. Some of the ways that we'll do this is having a quarterly house staff meeting where we can understand resident concerns. I also have an open door policy, and I love having residents stop by to chat, to share their ideas, or really just to find out what's going on in their lives. We survey residents annually asking for concerns and ideas, and we use these to make changes in the program. Our resident feedback will lead to substantial changes in our program, but what won't change is our focus on work-life balance and professional wellness, as well as professional development and achievement. Our faculty is diverse and experienced and is trained in different areas of medicine. With decades of combined years of academic medical education experience, our faculty are dedicated to offering residents the rotations, clinical experiences, and opportunities to help them begin to practice or match into a competitive fellowship.
So I'm very excited about this partnership with THR. They are a major healthcare delivery system in North Texas, therefore a very valuable resource from both an educational perspective, certainly a research perspective, and ultimately to be leaders in advancing where healthcare is going for improving and advancing care for the individual patient. Medicine is changing more rapidly than we can even imagine. So it's hard to change something that is already cast, which are many, the vast majority of academic medical centers in the country. This beautiful moment for us is we have just started a new medical school. We are starting a new residency program with Dr. Ryder, internal medicine residency program at THR Harris. This is the perfect opportunity. We are not beholden to the past. We get to design a curriculum and training that is really for the physician of the future, who will be a very different physician than the physician of the past. This partnership allows us to really build a brand new medical education ecosystem, but really an academic medical ecosystem. This is very valuable to our students because now they will have residents who are just a little older and more experienced than our students are to train them. Those are beautiful role models for our students. And quite frankly, our students will keep the residents on their toes, asking questions out of naivete because they are also trying to learn the profession. In regards to the benefit between the two entities, THR and the medical school, again, this is an opportunity for medical education, but we're also now tremendously growing medical research together. And this all will not only change the environment in North Texas, it will allow us to be leaders, both regionally and nationally. And it's an environment, again, where the medical students and the residents now can participate. And lastly, we will recruit a focused physician workforce that wants to be part of this academic medical center. And then lastly, in regards to the value of this for our community, we have, like many urban areas and rural areas for that matter in America, we have very underserved communities. This partnership will actually embrace and try to work on improving healthcare delivery and healthcare rather than just ignoring it and not paying attention to it. This is a powerful part of our mission as a medical school. It's also a powerful part of THR's mission. One of the assets of the medical school in its relationship with Dr. Ryder's program is we will work with the residents to train them to be educators. That's a big deal. It's not something anyone wants to take for granted, and quite frankly, this will help advance residents quickly in regards to how to teach. And needless to say, we become then, as the medical school and our medical students, part of the recipients of that teaching by house officers. And then I should add, it is a bi-directional teaching component. We will help teach the internal medicine residents in areas such as simulation, communication. So that's part of the asset. The medical school, in addition to training residents to be educators, will also train residents for the future of their practice of medicine. Very traditionally, the residents will be often the first touch point of a medical student in regards to their education, caring for patients, how to guide them, how to advise them. More globally, as the residents go through their training and become more and more mature, that process is very valuable for a medical student to see what that evolution looks like, what that role modeling is all about, because they're about to enter their residency programs 2-3 years from now. And now they can see what lies ahead for them in a very positive way, because it's very gratifying and fulfilling to watch a house officer start as a first-year resident, a little unsure, a lot of knowledge, hasn't quite figured out the nuance of caring for patients. And by the time they finish their residency program, They are nicely sophisticated, albeit young, physicians on how to care for their patients. Our students will watch all of that, and that is very valuable for their training.
I wanted to share with you some of the principles that really guided us as we were developing the residency program, and I want to provide you some examples of each one. First of all, I want to talk about some forward-thinking educational experiences that we really hope will appeal to you, but also will mimic how physicians practice now and in the future. We have an amazingly complex patient population here with a high case mix index, and we want to use that to provide high quality clinical and didactic experiences for you to learn with progressive independence and responsibility. We want to incorporate high value care and quality improvement as fundamental building blocks of transformative medicine. And we also have a commitment to wellness of you and of the patients that you serve. So I want to talk a little bit about some of these experiences. So first of all, we use an X+Y scheduling system, which if you haven't heard of yet, you will on the interview trail. And what that really is designed to do is to make sure you have an adequate outpatient clinical training. So the X or 4 refers to kind of your traditional curriculum or clinical structure, and then the Y or 2 refers to our ambulatory structure. So what does that mean for you? It means, again, for 4 weeks, you'll do something fairly traditional, an inpatient block, be that wards or intensive care, or you could, and then you'll have a week of clinic and a subspecialty week. And so you can see at the bottom of this slide what your clinic week would look like with continuity clinic, as well as our academic half day, our wellness half day, and then a discharge follow-up clinic. And then you would have your specialty week, in which you would still have some continuity clinic as well as your wellness, your academic, but you would also have the opportunity to rotate through internal medicine subspecialties in a longitudinal fashion and be able to really get to know and embed in that clinic opportunity. And then you're back to your X weeks. So here, this person has 2 weeks of elective followed by 2 weeks of vacation, and then they have their clinic and their specialty week. And so what happens there is that you are able to predict in the future when your clinic weeks are going to occur, book your patients, make sure you have continuity in your continuity clinic, as well as in your specialty weeks. It also means, as a wellness initiative, that you've got some 2-day weeks that you can predict that are coming every 4 to 6 weeks. You're going to definitely have those 2-day weeks. So you're not going to have a stretch of 3 months in the middle of the year where you never have a 2-day weekend. We kind of block out and make sure that you're getting time for your own life on a regular basis. So when we look at the overall schedule at a glance, and that's here, you can see that in the PGY 1 year, we're really hoping that you develop expertise in the inpatient setting, but you do have ample amount of opportunity for your primary care clinic, your subspecialty and elective experiences, and then of course, vacation, 4 weeks of vacation each year. We have neurology in the first year. The special opportunities in the PGY 2 year include geriatrics, emergency medicine, as well as a dedicated non-clinical quality improvement block. And then in our PGY 3 year, we have an ambulatory medicine block and an admitter block. I also want to point out that no one in our schedule does more than 4 weeks of night float. We believe that it's important to learn how to do medicine at night because it is different than medicine during the day, but we also want to balance that work and service and make sure that you are in a setting where you are going to learn as much as possible, which sometimes is at night, but often is during the day when you've got more attendings and conferences and those types of things to learn from. So progressive independence and responsibility is really important. And so we have designed our inpatient ward experience really to capture that. So as a PGY 1 resident, you represent the learner down here on the bottom left, and you would care for 10 patients being supervised by a senior resident, or in this instance, as brand new interns by an attending. When you become a PGY 2, you then have the opportunity to manage somewhat independently a group of patients working directly with an attending. And that enables you to really learn the systems-based practice of the hospital. And then when you are a PGY 3, you become the teacher of the team. So this means that you are able to supervise the PGY 1s and help them to learn how to take care of patients. We've also got students from both TCU as well as TCOM. And so the 3rd year students will likely be on our larger services, and the 4th year sub-Is will work alongside our PGY 2 residents, but take care of a different set of patients. High value care is really important to us, and we want to make sure that you're learning how to take care of patients in a high value way and also work on quality improvement. So we have a variety of things built into our curriculum, and you can see them listed here, both didactics as well as retreats. You have the opportunity to get a certificate in quality and safety. And then we also have a longitudinal curriculum in which you will learn the tools of quality improvement and then actually be able to implement those on the inpatient or ambulatory setting. And then finally, you have the opportunity to do clinic-based population health management. This is going to be in your continuity clinic, where you will be able to work with your preceptor to identify a high-value care goal and a quality improvement plan, and really be able to work to whether it's improve the A1C of your patients, decrease hypertension, weight loss, getting appropriate cancer screening, and then follow up using our EPIC tools to see how well your interventions have worked.
Good afternoon. I'm Dr. Jennifer Hinkle, the Associate Program Director. We're excited that you're spending the afternoon with us. A little bit about me. I've grown up in different areas of the country. I actually lived in Texas when I was younger, Pennsylvania, Illinois. I went to college in South Carolina and medical school at the Medical University of South Carolina in Charleston. I then came out to Texas to attend UT Southwestern for residency and then moved to Fort Worth after graduation. I actually worked as a hospitalist here at Texas Health for a few years and then moved to outpatient primary care, which I've been doing for the past 18 years. I've worked with medical students and residents. I've worked in their continuity clinic. And most recently, I was the medical director of the PA program here in Fort Worth. I'm married to an OBGYN, and I have 3 teenagers and 3 dogs, whom I sometimes enjoy more than my teenagers. Next, I'm going to talk about didactics. Our goal in our didactics is to teach skills and ideas that can be hard to learn on the wards, ensuring that your training is well-rounded. Our didactics are interactive and often case-based. We will have a noon resident report several times a week, an intern report and grand rounds each once a week. We also have an academic half day every week, during which attendings will cover your clinical service. This is a great opportunity to connect with co-residents and focus on your personal learning plan. Our academic half day provides opportunities to hone your medical knowledge and patient care skills with didactics such as primary care curriculum and the ADIM board review. We also have rotating monthly topics on professional development and ethics, journal club, high value healthcare, research, quality improvement, and patient safety, for which you will obtain a certificate from the Institute of Healthcare Improvement. During your PGY2 and PGY3 years, you'll be able to share what you've learned by presenting at our morbidity and mortality rounds. So I'm going to talk about our great benefits. Texas Health offers a very competitive stipend for residents. We match UT Southwestern stipend year on year. Imagine you're finally going to start getting paid. Fort Worth is a very affordable city, so you'll find your dollar goes much further than many metropolitan areas. We also provide a variety of comprehensive benefits for you and your dependents. There's a reason Fortune magazine has ranked us the top healthcare organizations in the country to work for. PGY1s start with almost $59,000 a year and will go up yearly. Health, dental, and life insurance for you and your family are provided along, of course, with malpractice insurance. You'll have the opportunity to purchase vision, long-term, short-term disability insurance, and also an option to participate in the 401k program. After a year, Texas Health will match contributions up to 6%. Texas Health also provides a confidential employee assistance program that offers multiple services, including short-term counseling and referral services, assistance with locating available childcare, health and wellness incentives, financial services, and legal assistance. All your fees for your license, DEA, ACLS, BLS training, memberships to AMA, the American College of Physicians, Texas Medical Association, and the Tarrant County Medical Association here in Fort Worth are covered by the program. You'll also receive 20 weekdays of paid time off or vacation per academic year, and 3 weeks of paid leave per year is available for qualifying parental leave. Food for conferences is provided along with a monthly food allowance for the cafeteria. You're provided with free parking and lots on the hospital premises. We also offer transportation through vouchers if you're too fatigued to drive yourself home after a shift. Unlikely to happen with no night call, but just in case. You'll also receive 2 monogram white coats and scrubs at orientation and 1 set of each for each subsequent training year. We have an all electronic medical record. We use Epic, and we want residents to have easy access to Epic. So we provide a laptop to each resident during orientation. The laptop is yours to keep until graduation, and it includes access to UpToDate. You will also receive subscriptions to the Annals of Internal Medicine and a complete set of mixed app, including all the components, the print, the digital flashcards, the question bank. As you move closer to graduation and taking the medicine board certifying exam, you may need to attend a board course, and if so, that will be covered by the program. We also encourage you to present your scholarly work at regional or national professional meetings, and allowances are available at the discretion of the program director. Financial assistance is available if you're presenting a lecture, abstract, or poster at a regional or national meeting. We want you to be able to take care of yourself as you hone your skills in taking care of others. Wellness and well-being is a core tenet of our program. As mentioned previously, you'll have 4 weeks of vacation per year. There's no call, and there are no more than 4 weeks of nights per year in each year of our program. There are also scheduled half days during your clinic weeks to attend to healthcare needs, catch up on administrative paperwork, or just have some time off. There is a dedicated wellness faculty member who will help promote health and professional well-being through small groups, mentoring, and the Clinician Experience Project. This is an app-based program used throughout Texas Health for coaching physicians, building teams, and developing leaders. You'll also have an opportunity during residency to become a certified expert in physician well-being through the Clinician Experience Project.
We want to prepare you to enter the next phase of your professional development by providing opportunities for you to determine what you're passionate about, and by helping you find a position, either in fellowship or in employment, that will allow you to grow professionally after graduation. We want to help you learn to take excellent care of your patients and be successful in passing the boards upon graduation. Our subspecialty weeks mean that you will have early exposure to all of the medicine subspecialties and the ability to interact with our amazing faculty. We'll also help you tailor your CV to maximize your success in getting your dream job or matching into fellowship by providing opportunities to participate in committee work and research in the field of your choice. Thank you for choosing to spend the day with us. I look forward to speaking with you soon.
Tina Timmer. I'm the program coordinator here at Texas Health Harris Methodist Hospital, Fort Worth, for the Department of Internal Medicine. I have a presentation to share with you today on diversity, equity, and inclusion, and what that means to us here at Texas Health. First, I want to give you a little background information on my history and my journey with GME. I started my journey in 2007 at the University of Arkansas for Medical Sciences in the Division of Cardiology. I managed the Cardiovascular Disease, Interventional Cardiology, and Electrophysiology Fellowships. In 2012, I joined the Department of Neurology as their residency coordinator. In 2015, I moved over into the Department of Ophthalmology. They were going through some transition over in their residency program, so I helped them in their program for about 6 months. And in 2015 as well, I was also recruited into dermatology at Penn State Hershey Medical Center. In 2020, I joined Texas Health Harris Methodist Hospital here in good old Texas with the Department of General Surgery and building out their, I was hired on to build out their residency program as they were going for accreditation with the ACGME. We have successfully pioneered that program, and that program is officially training residents as of July 1st, 2021. It's pretty exciting to see them on board. And we've made history here at Texas Health. In 2021, of course, I moved over into the Department of Internal Medicine here. I am working with Dr. Ryder. She and I have built out our program and received accreditation, and we will be successfully training residents as of July 1st, 2022. So we're all pretty excited about that. The whole hospital is excited about it. So this is, again, we're making history here at Texas Health Harris. Now back to the DEI stuff. Texas Health is unified by our mission, vision, values, and our Texas Health promise. These are the heart of our Texas Health's identity and culture. Diversity and equity, inclusion within Texas Health and in our communities is woven into the fabric of our identity. Individuals caring for individuals together is about caring for all individuals and recognizing the unique behavior, backgrounds, and gifts that we all bring to the table. Our Texas Health Promise celebrates an approach to embrace the ways that we are all different to make us all stronger. At Texas Health, we do not tolerate any type of discrimination at all. Our core values are respect, integrity, compassion, and excellence. Make no distinction regarding race or gender, religious beliefs, or sexual orientation, or any dimension of our humanity. We strive to create a workplace that reflects the diverse communities which we are privileged to serve and where inclusion exists at all levels. Texas Health is a place where everyone belongs and feels empowered to be their authentic self, a place where diversity is celebrated and a strength, and equity is a pillar woven into our culture. Diversity is about the ways that we're all unique. It's the characteristics and traits, both visible and invisible, in which we're all different and alike. Equity is about creating a work environment where everyone has an equal opportunity and is not disadvantaged because of their diversity or their unique attributes that make them different. It's important to note that equality and equity are not the same. Equality is more about the sameness or equal distribution. But based on someone's experience and situation, we might need to interact or treat them, different. So it's about the equity. Inclusion is about an environment where we all have the opportunity to fully participate and everyone's contribution is valued and celebrated. You can have a diverse group, but if you're not given that seat at the table and listened to, then you don't really have an inclusive environment. Ultimately, it's about each of us being more aware and actively seeking opportunities to do better and be better. Yeah, so, we look forward to having you guys join us. So whether you're a resident trainee, a faculty physician, a leader, an employee, or a volunteer, we all must take part in embracing, promoting, and creating a more diverse, equitable, and inclusive environment for all. And this is what we do here at Texas Health.